नमस्कार. आज आपण अँटीहिस्टॅमिनिक ड्रग्ज विषयी डिस्कस करणार आहोत. तर ते डिस्कस करण्याआधी आपण हिस्टॅमिन रिसेप्टर विषयी जाणून घेऊया. आणि आपल्याला माहीतच आहे की हिस्टॅमिन हे जे ऑटोकॉइड्स आहे हे आपल्या शरीरामध्ये व्हेरियस टिश्यूमध्ये असतात, मास सेलमध्ये असतात आणि हिस्टॅमिन हे जनरली ॲलर्जिक कंडिशन्स किंवा जे इन्फ्लेमेटरी प्रोसेस असेल तर त्यामध्ये त्याचा रोल आहे. मोस्ट रोल जो आहे हिस्टॅमिनचा हे जनरली ॲलर्जिक कंडिशन्समध्ये जास्त कॉमन आहे. तर हिस्टॅमिन नावाचा जो ऑटोकॉइड आहे हा ऑटोकॉइड हिस्टॅमिन रिसेप्टर थ्रू ॲक्ट होतो. हिस्टॅमिन रिसेप्टरचे जर टाईप पाहिले आपण तर H1, H2, H3, H4 असे 4 प्रकार पडतात. ओके, तर at least you should know about H1 and H2 receptor in details. The exam point of view, a CCMP exam point of view, this topic is important for short note of point of view. जर अँटीहिस्टॅमिनिक ड्रग्स अशी शॉर्ट नोट आली तर त्यामध्ये तुम्हाला H1 अँटीहिस्टॅमिनिक्स पण मेन्शन करणं गरजेचं आहे आणि H2 अँटेगोनिस्ट जे आहेत H2 अँटीहिस्टॅमिनिक्स ते पण मेन्शन करणं गरजेचं आहे. तर H1 आणि H2 जे रिसेप्टर आहे त्या रिसेप्टर विषयी आपण जाणून घेऊया, त्याचे ऍक्शन्स काय असतील आणि त्यानंतर ते रिसेप्टर जर ब्लॉक झाले तर काय ऍक्शन होऊ शकते हे आपण पाहणार आहोत. तर H1 जे रिसेप्टर आहे हिस्टॅमिनचा ते GQ टाईप रिसेप्टर आहे. म्हणजेच हा रिसेप्टर जर ऍक्टिव्हेट झाला हिस्टॅमिनने so there is activation of IP3 diacylglycerol pathway, and when this phospholipase A2 IP3 diacylglycerol pathway is activated, there is increased intracellular release of the calcium from the store. Okay, so in the cell level of calcium is increased, so release of calcium from intracellular store is increased. There is activation of protein kinase C. Okay, so this is the action occur due to activation of H1 receptors. So H1 is GQ type receptor. H1 is GQ type receptor. In addition to, you have to remember this in H1 receptor activation on the endothelium of the blood vessel responsible for release of nitric oxide and which increases cyclic GMP level in the blood vessels, or we can say smooth muscles of the blood vessels. मग जर नॉर्मली आता हे H1 रिसेप्टर कुठं प्रेझेंट असतात, दे आर प्रेझेंट ऑन स्मूथ मसल्स, ब्लड वेसल्स. ओके, त्यानंतर ॲफ्रॉन नर्व एंडिंग्स, गँग्लियॉन सेल, ॲड्रेनल मेड्युला, हार्ट एव्ही नोड, युटेरस, ब्रेन या ठिकाणी H1 रिसेप्टर्स प्रेझेंट असतात. ओके, आणि हे सर्व GQ टाईप आहे आणि ते स्टिम्युलेशन झाले तर एक्साइटरी फंक्शन्स जे आहे ते वाढणार आहे, तर एक्साइटरी इफेक्ट वाढतो. ओके, in contrast to that H2 type histaminic receptor, they are GS type receptor. Due to stimulation of H2 receptor by histamine, there is activation of adenylyl cyclase which increases cyclic AMP level and which results in activation of the protein kinase A. तर जे GS टाईप रिसेप्टर आहेत ते सायक्लिक एएमपी वाढवतात हे आपल्याला माहित आहे. तर H2 रिसेप्टर इज अ टाईप ऑफ दिस GS टाईप रिसेप्टर. H2 रिसेप्टर ग्लॅस्ट्रिक ग्लँड्सवर मेनली आहे. ओके, मेनली परायटल सेल्सवर जे प्रेझेंट असतात, ब्लड व्हेसल्स, हार्ट, युटेरस, ब्रेन हे त्याचे काही लोकेशन्स आहेत. तर एक्झाम पॉईंट ऑफ व्ह्यू रिसेप्टर्स महत्वाचे नाही आहेत, पण तुम्हाला टाईप ऑफ रिसेप्टर्स माहीत पाहिजे आणि त्यांचे लोकेशन ॲटलिस्ट माहीत पाहिजे, जेणेकरून आपल्याला त्याचे ॲक्शन्स काय असू शकतात हिस्टॅमिनच्या आणि हिस्टॅमिनच्या ॲक्शनवरून अँटीहिस्टॅमिनिक ड्रगचे ॲक्शन काय असू शकतात ते आपण पाहू शकतो. H3H4 मी डिटेलमध्ये जाणार नाही. दे आर G0 टाईप G प्रोटीन कपल रिसेप्टर्स. आता हे रिसेप्टर्स ऍक्टिव्हेट झाले तर काय होऊ शकतं? तर जे H2 रिसेप्टर्स आहेत, त्याविषयी आपण पेप्टिक अल्सर टॉपिक मध्ये पाहिलं होतं की H2 रिसेप्टर प्रेझेंट ऑन द parietal cell, okay, on basolateral membrane. When histamine is released from the enterochromaffine cell, this histamine acts on this H2 receptor and which responsible for activation of proton pump, and there is release of H plus which combines in the circle in the stomach, and this H plus combines with Cl minus to form gastric acid. So gastric acid secretion is increased. So this is histamine mediated acid secretion and it takes place through H2 receptor. So drugs which block H2 receptor, H2 antagonist we can say, they are useful to decrease acid secretion from the parietal cell, and due to this reason we use H2 antagonist in the management of peptic ulcer. सो त्याचे एक्झाम्पल आपण पाहिलेले आहेत एस टू अँटागोनिस्टचे, सिमिटिडिन, रॅनिटिडिन, पॅमोटिडिन, लोक्झाटिडिन. खूप सारे जे एक्झाम्पल जे आहे ते ऑलरेडी पेप्टिक टॉपिक मध्ये डिस्कस केलेले आहे. जर अँटीहिस्टॅमिनिक शॉर्ट नोट आली ओव्हरऑल अशी, तर त्या दोन्ही तुम्हाला लिहायचं आहे, एस टू अँटागोनिस्ट आणि H1 अँटागोनिस्ट. तर एस टू अँटागोनिस्ट ऑलरेडी आपण पेप्टिक मध्ये डिस्कस केलेले आहे, त्याचे युजेस पाहिलेले आहे, तर ते एकदा तुम्ही ओव्हरलुक करून घ्या. आता आपण H1 रिसेप्टर थ्रू ज्या ऍक्शन्स होत आहे हिस्टॅमिनच्या त्या पाहणार आहोत. तर ब्लड वेसलवर H1 H2 receptor असता and both responsible for vasodilation. So how vasodilation occur we will discuss. Actually, on majority of the smooth muscles there is a constriction of the smooth muscle through histamine, but smooth muscles of the blood vessels are relaxed. It is resulting in vasodilation. So how smooth muscles of the blood vessel relax due to action of histamine on H1 receptor. Please remember H1 receptors which are present on the endothelial cell. Activation of this receptor releases nitric oxide which results in increased cyclic AMP formation, cyclic GMP formation, and this cyclic GMP responsible for smooth muscle relaxation. So histamine acts on H1 receptor present on endothelial cell and releases nitric oxide, and due to that, this cyclic GMP level is increased, and the cyclic GMP mediates smooth muscle relaxation occur. H2 receptor activation directly also responsible for smooth muscle relaxation through increased cyclic AMP level. So both his H1 H2 receptor activation on blood vessels result in relaxation of smooth muscle or vasodilation occur. So this takes place, action of H1 activation results in release of nitric oxide. We have discussed it is also called as endothelial derived relaxing factor. ओके. आता जे मॅनिफेस्टेशन असतील त्यात मग डिक्रीज बीपी असेल, हिस्टॅमिन जर रिलीज झाला, जसं आपण म्हणू शकतो की जे अनाफिलेक्टिक शॉक मध्ये वन ऑफ द मीडिएटर जो रिलीज होतो तो हिस्टॅमिन असतो. तर हिस्टॅमिन रिलीज झाल्यामुळे काय होऊ शकतो, डिक्रीज इन बीपी, आणि बीपी डिक्रीज झालं तर रिफ्लेक्स टॅकिकार्डिया होऊ शकतं. व्हॅसोडायलेटेशन झाल्यामुळे फ्लशिंग होऊ शकतं, पल्सेटिंग हेडेक होऊ शकतं. आता जर डायरेक्ट मसलवर ऍक्शन पाहिली H1 रिसेप्टरची, म्हणजे जे H1 रिसेप्टर स्मूथ मसलवर प्रेझेंट आहे, तर तिथं जर डायरेक्ट हिस्टॅमिन ऍक्ट झाला, जसं ऍसिटिल कोलिन मध्ये पाहिलं, तर लार्जर व्हेन्स आणि आर्टरीजचं व्हॅसो कॉन्स्ट्रिक्शन होतं, आणि इट इज ड्यू टू इन्क्रीज activation of IP3 diacylglycerol pathway resulting in increased calcium in the smooth muscles. Capillary permeability is increased, so there may be exudation of the plasma. Edema may occur due to activation of H1 receptor through histamine. तर आपण काय पाहतात की हिस्टॅमिन मुळे कोणत्या ऍक्शन होतात. जर आपण ह्या ऍक्शन्स माहिती करून घेतल्या तर अँटीहिस्टॅमिनिक ड्रग मुळे कोणत्या ऍक्शन होतील ते आपण लक्षात ठेवू शकतो. हिस्टॅमिन मुळे ट्रिपल रिस्पॉन्स पण दिसतो, म्हणजे जर इंट्राडर्मल हिस्टॅमिनचं इंजेक्शन दिलं तर देर इज रेड स्पॉट. इट इज ड्यू टू इंटेन्स कॅपिलरी डायलिटेशन There is fill. Fill is due to exudation of the fluid from the capillaries and the venules, and flare is nothing but the redness surrounding area of surrounding area. It is due to arteriolar dilatation mediated by axon reflex. So triple response is seen with histamine. Heart, no direct effect of histamine in situ heart is not prominent. Visceral smooth muscle, we have discussed. Histamine responsible for contraction of various visceral smooth muscle. It is through H1 mediated contraction of the smooth muscle. Histamine acts on H1 receptor. There is activation of phospholipase A2 IP3 diacylglycerol pathway, and it results in increased intracellular calcium, and this responsible for contraction of the smooth muscle. So there is a contraction of the bronchial smooth muscle. There is abdominal cramp and colicky pain occur due to histamine. Okay, so in case of anaphylactic shock, there is bronchoconstriction. So it is one of the mediator for that is histamine. Okay, glands secretion from various glands is increased. Histamine responsible for increased acid secretion. We have discussed histamine is released from enterochromaffin cell in case of stomach, and it acts on H2 receptor present on the parietal cell, and due to that there is increase in cyclic AMP level in parietal cell, which responsible for activation of proton pump and increase H plus secretion, which combines with Cl minus to form acid. So histamine responsible for acid secretion. That's why antihistaminics, H2 antihistaminics are useful in the management of acidity, peptic ulcer, example of cimetidine, ranitidine, famotidine, loxatidine. Okay, it has also it has less marked effect on pepsin and intrinsic factor secretion. Okay, we have already discussed in this topic in peptic ulcer. I am not going in detail. Okay, peripherally administered histamine does not penetrate the brain, so no CNS effect occur. But CNS effects are produced by intracerebroventricular administration of histamine. What happens due to administration of histamine? Histamine acts as a neurotransmitter in the CNS, and all four types of histamine receptors are present in the brain. So, in brain, concentration of H1 receptor is highest in hypothalamus, and due to activation of this histamine receptor, which responsible for wakefulness and suppression of appetite. That's why antihistaminic drugs responsible for sedation. Histamine produce wakefulness, histamine responsible for suppression of appetite. So antihistaminic drug produce sedation. Even antihistaminic drug cyproheptadine is used as a appetite stimulator to increase the appetite in some patients. Okay. Then intracerebroventricular injection also responsible for hypothermia, hypertension, vomiting, and ADH release. So histamine is involved in vomiting also. So some antihistaminics are useful in the management of vomiting. Okay. Peripheral nervous system. Histamine is a very potent stimulant of peripheral sensory nerve ending that mediate pain and itching. So histamine is one of the analgesic substance. It increases peripheral sensory nerves. It stimulates peripheral sensory nerve endings. Okay. Autonomic ganglia and adrenal medulla stimulation occur due to histamine, and there is increased release of adrenaline, which results in rising BP. This is the secondary rise in BP. Okay. So these are the actions of histamine. Not important for exam point of view. Just you have to remember this while discussing antihistaminic drugs. Okay. Among histamine analogs, beta histine is commonly used in the controlling of vertigo in Meniere's disease. So H1 selective histamine analogs is a beta histine. So in case of vertigo due to Meniere's disease, we use this beta histine. It possibly act by causing vasodilatation in the internal ear. Okay. Coming to the antihistaminic drug, in this video I am going to discuss H1 antihistaminics. Okay, H2 antihistaminics we have already discussed in the management of peptic ulcer. Okay, so depending on the generation, there are two types of antihistaminic drug: first generation antihistaminic drug and second generation antihistaminic drug. You should know the differentiating point between first generation and second generation antihistaminic drug. So first generation antihistaminics have some additional actions like additional anticholinergic action. They're responsible for CNS depression. They enters into the brain to produce CNS depression. Second generation antihistaminics devoid of anticholinergic action, and second generation antihistaminics also do not responsible for sedation. So in differentiating point, we will discuss again these differences. So speaking about first generation antihistaminics, we have various drugs available, and depending on their sedative property, they are divided into highly sedative, moderately sedative, mild sedative. Highly sedative and first generation antihistaminics, we have diphenhydramine, dimenhydrinate, promethazine, hydroxyzine. Moderately sedative, we have pheniramine, cyproheptadine, meclizine, cinnarizine. Mild sedative, we have chlorpheniramine, dexchlorpheniramine. Okay, then we have triprolidine and limastine. So these are the first generation antihistaminic. So at least you have to remember the example: diphenhydramine, dimenhydrinate, promethazine, hydroxyzine, pheniramine, cyproheptadine, meclizine, cinnarizine, chlorpheniramine maleate, dexchlorpheniramine. Okay, so these are the some example of first generation antihistaminics. Second generation antihistaminics, they do not have anticholinergic activity, they do not produce CNS depression, so side effects are less as compared to first generation. But if we consider the uses, the first generation antihistaminics we use for many in many condition. The second generation antihistaminic mainly we use for the anti-allergic point of view. We will discuss in uses in detail about this. Okay, so in second generation we have fexofenadine, we have cetirizine, we have levocetirizine, loratadine, desloratadine, rupatadine, azilastine, mesolastine, and ibastine. These are the example of second generation antihistaminic. So don't confuse rupatadine, loratadine with cimetidine, ranitidine. Okay, cimetidine, ranitidine, these are the H2 antagonist. While in H1 antagonist, second generation, we have this loratadine and rupatadine. So this is about the classification, and this topic may be asked for short note. Classify H1 antihistaminics and enumerate various uses of antihistaminics. Okay, so we have discussed the classification. Before discussing actual uses, I would like to discuss pharmacological actions of antihistaminic, and then from that you can usually remember the uses. So this histamine antihistaminic drug, H1 antihistaminic drug responsible for antagonism of histamine. So H1 antagonist or H1 antihistaminics, we can say, effectively block histamine induced bronchoconstriction, contraction of intestinal and other smooth muscle, also block triple response, especially wheel, flare, and itch. Fall in BP produced by low doses of histamine is blocked, but additional H2 antagonists are required for complete blockage of that caused by higher dose. So you have to remember this H1 antihistaminics antagonize the action of histamine, mediated through H1 receptor. So this H1 antihistaminics blocks histamine-induced bronchoconstriction, contraction of the smooth muscles, as well as triple response. Also, fall in BP produced by low doses of histamine is blocked by antihistaminic drug. Okay. Release of adrenaline from adrenal medulla is also blocked. Okay. Release of adrenaline from adrenal medulla is blocked. Constriction of larger blood vessel by histamine, we have discussed. There is a contraction of larger blood vessels. So constriction of larger blood vessel by histamine is also antagonized by antihistaminic drug. Okay. And these drugs, this H1 antagonists, not affect histamine mediated gastric secretion, because in that case histamine acts through H2 receptor. Okay, so gastric secretion is not affected by H1 antihistaminics. Coming to the anti-allergic actions, so we know that in type 1 hypersensitivity reaction or immediate hypersensitivity reaction, there is urticaria, itching, angioedema. Okay, anaphylactic fall in BP may occur. So one of the mediator of this anaphylactic reaction is histamine. So if we use antihistaminic drug H1 antagonist, many manifestation of immediate hypersensitivity reactions are suppressed. Urticaria, itching, angioedema are well controlled. Also, there is improvement in the blood pressure. It is partially reversed. Okay, so anaphylactic fall in BP is only partially prevented. Uh, if we consider the pathophysiology of bronchial asthma, these histamines have very little role. That's why antihistaminics are not beneficial in the management of bronchial asthma. In that, you have to remember, in pathophysiology of bronchial asthma, there is a main role of leukotrienes like C4, D4, platelet activating factor. These are more important mediators in the pathophysiology of asthma than histamine. That's why antihistaminic drugs are not very effective in the management of bronchial asthma. त्यामुळे आपण ब्रॉन्कियल अस्थमाच्या क्लासिफिकेशन मध्ये अँटीहिस्टॅमिनिक्स डिस्कस केलेले नाही आहे. ठीक आहे, तर ही दुसरी ऍक्शन झाली आपण पाहतोय. तिसरी CNS ऍक्शन. नाउ वी हॅव डिस्कस फर्स्ट जनरेशन अँटीहिस्टॅमिनिक ड्रग can cross blood-brain barrier easily. Second generation antihistaminics poorly cross blood-brain barrier. That's why CNS effect seen with first generation antihistaminic drug. And overall, this antihistaminic drug responsible for CNS depression. So variable degree of CNS depression occur due to use of first generation antihistaminic drug, first generation H1 antagonist. Okay, so there is what will happen due to CNS depression? There is sedation, inability to concentrate, and disturbance of coordination may occur. These are the common manifestations. So when we prescribe H1 antihistaminics, mainly first generation, we should avoid. We should advise the patient about not to drive, not to do any machinery work where concentration is required. Okay, so this is about the CNS effect. Second generation antihistaminics poorly cross blood-brain barrier, no CNS depression seen, so they are non-sedative drugs, non-sedative antihistaminics. Okay. Now we have discussed at therapeutic dose CNS depression is seen, but when we use toxic doses of H1 antihistaminic, CNS stimulation characterized by convulsion, tremors, and insomnia occurs. Now There are some first generation antihistaminics we use in the prevention of motion sickness. So for prevention of motion sickness, we use promethazine, we can use diphenhydramine, dimenhydrinate, meclozine. Then, so these are the antihistaminics first generation we use in motion sickness for preventive point of view. How they are effective? Please remember this the main important difference between first and second generation. They have first generation antihistaminics have additional anticholinergic property, while second generation antihistaminics do not have additional anticholinergic property. And due to this anticholinergic property, what happens in the pathophysiology of motion sickness we have discussed. There is a stimulation of inner ear vestibular apparatus of inner ear, and from that during traveling due to activation of this vestibular apparatus, signals are transmitted from vestibular apparatus to omitting center through cholinergic link. And in the omitting center there is release of acetylcholine, and which acts on the muscarinic receptor and activate the omitting center. So muscarinic receptor is a type of cholinergic receptor. So indirectly we can say in omitting center, due to activation of this cholinergic receptor, there is omitting. So in motion sickness, there is a role of acetylcholine, okay, in the pathophysiology of motion sickness. So anticholinergic drugs are very effective in motion sickness. So we can use hyoscine, or we can use antihistaminics having anticholinergic property. So in that we can use first generation antihistaminic like promethazine, diphenhydramine, dimenhydrinate, and meclozine. And we should start this drug up to 1 hour before expected time of journey. Okay. Promethazine is very popular. Avomine 25 milligram is the tablet we use for prevention of motion sickness. Promethazine also controls vomiting of pregnancy and due to other causes like radiation induced vomiting, chemotherapy induced vomiting. Cyproheptadine, additional 5-HT2 blocking action, and it is a appetite stimulant effect is its appetite stimulant effect is significant. So this is the very important of this use of cyproheptadine. Actually, it is an off-label use. In clinical practice, cyproheptadine is commonly used as a tonic point of view, as a stimulant of appetite. Okay, cyproheptadine, cyproheptadine. Okay, and due to CNS depressant action, we use this anti first generation antihistaminics for anti-tissue point of view. Anti-tissue, these are the drug we use in case of dry cough. These are the drug which responsible for suppression of cough center. So antihistaminics are not selectively suppressing the cough center. Overall CNS depressant action is there, anticholinergic action is there, and due to that cough centers are suppressed. Overall sedation effect is there, and due to that anti-tussive point of view, we use antihistaminic drugs in the management of dry cough. तर खूप सारे कफ फॉर्म्युलेशन जे आहेत ज्यात आपण ड्राय कप साठी देतो, त्यामध्ये H1 अँटीहिस्टॅमिनिक्स आपण ऍड करतो. ओके. Third, anticholinergic action. First generation antihistaminics have additional anticholinergic action, and due to this reason, they are effective. First generation antihistaminics have additional uses. First generation antihistaminics are useful in the management of motion sickness. They are also useful in the management of drug-induced Parkinsonism. We have discussed for drug-induced Parkinsonism, drug of choice is one of the anticholinergic drugs like benzhexol we can use. Okay, piperidine, procyclidine we can use. But in addition to that, we can use antihistaminics having anticholinergic property to treat drug-induced Parkinsonism. So for drug-induced Parkinsonism, drug of choice is one of the anticholinergic drug. Levodopa is not effective in the management of drug-induced Parkinsonism. Also in the idiopathic Parkinsonism, we know that levodopa is the drug of choice. Okay, but it is associated with many adverse effects. So if disease is mild in early stage, we can use anticholinergic drug for some days. So in that case, we can use antihistaminics having anticholinergic properties. So first generation antihistaminics we can use for this purpose. So bromethazine and some other first generation antihistaminics we can use for this purpose. However, this additional anticholinergic action responsible for some side effects also. So first generation antihistaminic associated with dryness of mouth, blurring of vision, urinary retention and constipation. These are the additional adverse effects in addition to their antihistaminic adverse effect. Okay, so this is also you have to remember. So first generation antihistaminics have additional anticholinergic adverse effect like dryness of mouth, blurring of vision, constipation, and urinary retention. Second generation antihistaminics do not have additional anticholinergic action. So second generation we can't use in motion sickness, drug-induced Parkinsonism, or they don't have anticholinergic adverse effect also. Local anesthetic action seen at high dose have antiarrhythmic property, not used clinically for this local anesthetic action point of view because of their irritated nature. Effect on BP. Most antihistaminic causes fall in BP on IV injection due to direct smooth muscle relaxant and alpha blocking action. However, fall in BP is not seen after oral administration. Okay, we can use orally, parentally. First generation antihistaminic cross blood-brain barrier. Second generation do not cross blood-brain barrier. Metabolism in liver, excretion through kidney. Coming to the side effect and toxicity of antihistaminic drugs, sedation, dizziness, inability to concentrate, motor incoordination. These are the classical adverse effect of first generation antihistaminics because they easily cross blood-brain barrier and produce CNS depression. Anticholinergic side effects seen with first generation antihistaminics. These are dry cough, blurring of vision, constipation, and urinary retention. Second generation antihistaminics are largely free of CNS adverse effects. Local application in the eye may produce contact dermatitis. Teratogenic potential recorded in animal study with hydroxyzine, cyclizine, fexofenadine, and at higher dose, CNS stimulant effect like central excitation, tremors, hallucination, convulsion, muscular incoordination, hypotension, searching occur. Death due to respiratory paralysis and cardiovascular failure. So this is about the side effects. Now, in the short note, sometimes difference between first and second generation antihistaminics may ask. So here we will discuss the differentiating point between first generation antihistaminics and second generation antihistaminics. First generation antihistaminics are lipid soluble while second generation antihistaminics are lipid insoluble. That's why you have to remember first generation antihistaminic easily crosses blood-brain barrier and they have CNS depressant action. Second generation antihistaminic poorly crosses blood-brain barrier and they don't have CNS depressant action. So sedation is the classical adverse effect of first generation antihistaminic drug. Sedation is not seen with second generation antihistaminic drug. There is due to CNS depression, there is impairment in psychomotor performance. So there is lack of concentration, motor incoordination seen with first generation antihistaminic drug. Such impairment is not seen with second generation antihistaminic drug. Okay, so uh, while prescribing first generation antihistaminic drug in patient, we should advise the patient that not to drive or not to work on machinery. Okay. First generation antihistaminics have additional anticholinergic action. Second generation, they don't have additional anticholinergic action. So due to this anticholinergic action, spectrum of first generation is more regarding uses, and also first generation responsible for additional adverse effect. Okay. With first generation, you have to remember they do not have additional anti-allergic mechanism, so only they have H1 antihistaminic action. Second generation have additional anti-allergic mechanism. They interfere with the action of leukotriene and platelet activating factor. So first generation, no additional anti-allergic action. With second generation, anti-allergic action is seen. Anticholinergic side effects seen with first generation, anticholinergic side effects will not seen with second generation. Okay. So when patient is on first generation antihistaminic, we should advise that better not to operate motor vehicle or machinery requiring constant attention. Second generation, yes, no sedation is there, so can operate motor vehicle, machinery requiring constant attention. First generation, effective for allergy point of view. Second generation also we use in allergic reaction. But in addition to that, in addition to allergic condition, this first generation effective as anti-emetic, anti-pruritic, anti-tissue, anti-Parkinsonian. Second generation, they we are not using this drug uh, in various these drugs have poor anti-emetic action, poor or no antipruritic action, no anti-tissue action, and no anti-Parkinsonian action. So we can't use these drugs in vomiting, in cough, or to treat drug induced Parkinsonism. Okay. Example of first generation antihistaminic: promethazine, diphenhydramine, dimenhydrinate. Example of second generation: cetirizine, fexofenadine. Okay. So this is about the first and second generation antihistaminics differences. So please go through that. This may be asked as a part of short note. And coming to, so in short note, classification, difference between first and second generation, and uses. Coming to the first use, allergic disorder point of view, yes, we are using antihistaminics commonly. They do not suppress antigen antibody reaction but blocks the effect of release histamine in response to this antigen antibody reaction. So they block action of histamine through H1 receptor. So they have only palliative role. They effectively control certain immediate type of allergy such as itching, urticaria, seasonal hay fever, allergic conjunctivitis, angioedema of lips, eyelids. However, the onset of action is slow. That's why in anaphylactic shock, drug of choice is adrenaline. We use antihistaminic like chlorpheniramine maleate by IV route as a adjuvant. Okay, also corticosteroid we use as an adjuvant, but drug of choice in anaphylactic shock is adrenaline. They are not effective in bronchial asthma. We have already discussed the reason. Other conditions involving histamine release, these antihistaminics block the symptom produced by histamine releaser. It affords systematic relief in insect bite and IV poisoning. So in insect bite, there is histamine release and allergic response. So in case of scorpion bite, also we can use antihistaminic. Okay, in poisonous scorpion bite, we require prazosin. Okay, and they have prophylactic role in blood or saline infusion induced rigor also. Okay, third use, pruritus. Due to their anti-pruritus action, we can use antihistaminic drug. Okay, in pruritus. Common cold, Antihistaminics do not affect the course of the illness but afford symptomatic relief by their anticholinergic action and sedative action. Due to anticholinergic action, there is reduction in rhinorrhea. Newer non-sedating antihistaminics are less effective in this case, okay, for common cold point of view. Coming to the next, we have already discussed this anticholinergic drugs are effective in motion sickness. We can use hyoscine or we can use antihistaminic drug having anticholinergic property like promethazine, diphenhydramine, dimenhydrinate. Due to their additional anticholinergic action, these drugs are effective in motion sickness. These drugs block the cholinergic link between vestibular apparatus to vomiting center. So up to 1 hour before expected journey, we should start this drug. So promethazine 25 milligram tablet is commonly used for this purpose. In addition to that, they are also effective in other types of vomiting such as morning sickness, drug-induced vomiting, disease-induced vomiting, post-operative vomiting, radiation associated vomitings. So these are the other indications of first generation antihistaminics. Uh, in case of morning sickness, this doxylamine is very commonly used in India. Doxylamine pyridoxine combination is very popular in the prevention of this morning sickness in pregnancy. So doxylamine is one of the drug which is used to treat morning sickness. We can use dicyclomine also to treat morning sickness. Okay, dicyclomine is anticholinergic drug. Vertigo, we know that it is nothing but the feeling of spinning sensation or rotation of surrounding or sense of movement when there is none. And vertigo is mostly of vestibular origin, but it may be due to variety of peripheral and central causes. And generally, vertigo is associated with nausea and vomiting. So, vestibular suppression, labyrinthine suppressant, we have to use to treat vertigo. So, along with antiemetic drug, we have to use this vestibular suppressant like cynarazine, diphenhydramine, diphenhydrinate we can use in vertigo. So cynarazine is the antihistaminic drug is more commonly used in the management of vertigo. Okay, so it is H1 antihistaminic drug. It has additional antimuscarinic action, anti-5-HT action, sedative and vasodilator property, and due to this, cynarazine is commonly used in vertigo. Beta-histine we have discussed, it is also used in vertigo mainly due to Meniere's disease. The anesthetic medication point of view, first generation antihistaminics we can use due to their anticholinergic property. Secretion, anti-secretory effect will occur. And also their sedative property is also helpful. Cuff, first generation antihistaminics we can use overall CNS depressant effect occurs, so cuff centers gets suppressed. Parkinsonism, for drug-induced Parkinsonism, we have discussed anticholinergics are the drug of choice. Levodopa is not effective, so we can use benzhexol, bipyridine, procyclidine. These are the anticholinergic drug, or we can use antihistaminic like promethazine. Okay, and they are effective due to their anticholinergic property. In case of acute muscular dystonia, it is seen due to use of T2 antagonists. So antipsychotic drug, older antipsychotic drug like chlorpromazine, like drug responsible for this adverse effect, acute muscular dystonia. It is due to D2 blocking action in the basal ganglia. So to treat this is a extrapyramidal adverse effect. We require drugs having anticholinergic property. So we can use anticholinergic drug or we can use antihistaminic drug having anticholinergic property. That is first generation antihistaminics we can use. So promethazine If we use parenterally, it promptly relieve this acute muscular dystonia produced by psychotic drugs, mainly dopaminergic antipsychotic drugs. As a sedative, hypnotic, anxiolytic point of view, we can use first generation antihistaminics, especially in children. However, respiratory depression may occur due to use of promethazine, so that's why it is not indicated in children aged 2 years or less. As a appetite stimulant point of view, to improve appetite, off-label we use cephalosporin. So these are the uses of H1 antihistaminic drugs. We have discussed the uses. So allergic point of view, we use in various allergic conditions. Then in case of insect bite, IV poisoning, to in case of pruritus, common cold, motion sickness, other types of vomiting like morning sickness, drug-induced vomiting, disease-induced vomiting, radiation-associated vomiting, we can use vertigo point of view, cinnarizine, diphenhydrinate we can use. Then in case of for pre-anesthetic medication point of view, we can use to improve. In case of dry cough, for antitussive point of view, we use these antihistaminics. Then in Parkinsonism, acute muscular dystonia, and as a sedative, hypnotic, anxiolytic point of view, also we can use antihistaminic drugs. H2 antagonist we have already discussed in the chapter of peptic ulceration, so I am not going in detail with this H2 antagonist. Please go through that H2 antagonist. Okay. So don't confuse between H1 antagonist and H2 antagonist. काही वेळा क्वेश्चन H1 antagonist विचारलेला असतो एक्झाम मध्ये, काही जण H2 antagonist विषयी लिहितात, कधी H2 antagonist विचारलेला असतो तर H1 antihistaminic ड्रग विषयी लिहिलं जातं. तर कन्फ्यूज नाही झालं पाहिजे H1 आणि H2 antagonist मध्ये. तर अशा प्रकारे आपण अँटीहिस्टॅमिनिक ड्रग्स डिस्कस केलेले आहेत. ओके. तर काही ड्रग इंटरॅक्शन मध्ये तुम्हाला एक लक्षात ठेवायचं आहे की जे ओल्ड काही अँटीहिस्टॅमिनिक्स ड्रग होते जसे टर्फेनाडिन, एस्टीमेझॉल, दे रिस्पॉन्सिबल फॉर टॉर्सेडिपॉइंटिस. इट इज one type of ventricular arrhythmia, and it is because of blockage of cardiac potassium channels, and this torsades risk is more with this terfenadine, estimazole. If we use this drug along with enzyme inhibitors like erythromycin, ketoconazole, itraconazole, grapefruit juice, because of this enzyme inhibitor, metabolism of terfenadine, estimazole is blocked, and the level of this drug will increase, and it results in increased risk of torsades. And due to this adverse effect, terfenadine and estimazoles therefore withdrawn from the market. In contrast to that, loratadine, fexofenadine, they have less risk of this torsades. Also, cetirizine is devoid of this arrhythmogenic potential. Okay. So this is about antihistaminic drugs. We have completed. Please go through that. काही difficulty असेल तर तुम्ही विचारू शकता.